Dr. Dumestre, board certified plastic surgeon, and I'm going to talk a little bit about the emotional component of recovering from surgery that involves body transformation. So this applies to my cosmetic patients, my transgender patients, my breast reconstruction patients, my tummy tuck patients, really anyone who is getting body modifications. So it's this known phenomenon. It doesn't occur in everyone, but basically where it takes a little minute for your mind and your brain to adjust to the changes that have gone on in your body. So our body, our brain doesn't like sudden changes in our aesthetics. Even aging, which happens so slowly, we still struggle to accept and see those changes. So when you have a sudden body transformation, and even worse if it's something that you did not want at all, like a breast cancer patient who's going through reconstruction, how you feel in those first few weeks really doesn't represent how you're going to feel long term. So you can certainly experience heightened emotions, really not feeling like your normal emotional self, just feeling emotionally unstable. If it was an elective type surgery, you can have feelings of regret, wondering why on earth you did this, initial feelings of really not liking your look or your appearance. Fortunately, those feelings are typically self-limiting and get better with time. But in my breast reconstruction patients, they'll report to me that sometimes they experience that after each stage. So even if each surgery is kind of getting them closer to that final aesthetic, just dealing with that emotional impact of constant change and constantly seeing those changes can add to a lot of emotional turmoil. And it doesn't have to be reconstruction. Like I was saying before, it can be my cosmetic patients who are super excited. They've been dreaming and wanting this change forever. And then it's just kind of like the initial shock. And I think it's a combination of being on your pain meds, clearing your anesthetic, everything's kind of swollen, there's bruising, there's kind of the fresh scars, and there's the big aesthetic change. So it's absolutely a thing, happens in a lot of patients. So if you are experiencing that, just kind of settle with it, know that it's normal, you're just getting adjusted, and then you can kind of truly assess how you're feeling about things a few months later. For my breast reconstruction patients, to get used to their new breast when you're not dealing just with the look, but also the feeling, people report it can take 1 to 2 years. Hope that helps. Leave any of your own experiences in the comments. I'm always super curious to hear.